My name is Sarah Bimbona. I'm a lecturer at Makerere University in Uganda, and I head the Entrepreneurship and Outreach Center. I've been with SophiA since inception, while we're working on the proposal, and it has been an amazing journey of learning and growth, and also being able to have an impact on the community that we are serving. SophiA is one of the most unique projects which almost tackles all the areas of sustainability, and I'm glad that it has touched on the areas that are really critical to human life. Things to do with health, to do with water and sanitation. These are the things that we battle with every single day, and also our inability to cover all the continent and all the country, specifically for Uganda with electricity. So SophiA in Uganda focus mostly on hospitals that are 100% off grid, and Buvuma was one of them, with a catchment area of about 1,100 people on the island. The project came in to, first of all, make sure that all the vaccines that are required can now be stored. Then we have the issue of clean water, safe drinking water. So for the community around Buvuma, all the water mostly is boiled by the local communities there in their households. Or if you want any bottled water, it has to be ferried in the island, which is very expensive and costs a lot of energy. But specifically for the patients who come to the hospital, water is a critical need that they really need, especially the mothers. They need water, they need to bathe, they need to drink warm water. So this is what SophiA came to give the African people, that you can now access with just your cup. Just go your basin, your bucket, get water and do whatever you want to do, using of course solar, and of course the issue of food. Most of the African hospitals do not provide food to their patients, and what SophiA did was to empower this hospital, give it a steam generated steam support, so that they're able to cook the food, which they can maybe give out for free or sell to the patients and their caretakers at a very, very subsidized process. So that is part of the energy that SophiA brought to the hospital. So it has been able to really solve most of the things that affect the human life.
Thank you very much.
Like I said, SophiA is one of those projects that I would say supports the sustainability part of it, because unlike where you leave the project and then if anything goes wrong, there's nowhere to get support. SophiA has put in place a system where we have the trustee of the community, we have the water management committee of the community, meaning that any excess energy, any excess water, even in the kitchen, can be rented out at a subsidized fee, and that money can go into the trustee. In case there is any breakage, any issue to do with the system, then they have the money, because in most cases it's the lack of the money to sustain the project. Here, the community and the caretakers of the system will have access to the financial resources to make sure that there is continuity of the project, and of course continuity in making sure that it solves the problem that it came to solve for the people of Buvuma and for Africa at large.